Welcome to yet another video of Tackling Careers with Arehone.
I am a registered nurse by profession.
How does one apply?
Let's establish the fact that you need to have proper and right requirements. We nurse first, baby.
We nurse first, babies.
I had to leave and come back home.
Yeah.
Unemployed. The green one is the midwifery. The yellow one is the psychiatry, vescopisi.
Hi guys, welcome back to my YouTube channel. Welcome to yet another video of Tackling Careers with Arehone. I am back after a couple of months. I am back, and this time around I am with Katso. I don't think I even have to describe what profession she is in. You guys can see it, but please give us a little bit of description of what profession you are in. We'll get into it proper, but you can just give us a description for those who don't know, and also for those who are watching the videos outside of South Africa, in case this is not very uniform for them. Yeah, tell us who you are, a description in one sentence of what you do.
Oh, okay. My name is Katso. Well, Dima Katso.
What?
Yes, but I prefer Katso.
All along I thought Katso is a full name.
Yeah, it's fine like that. I prefer
Okay,
Katso.
cool.
Katso Mukhabudi. I'm from Pretoria and I am a registered nurse by profession. But to be more precise, I am a midwife.
Yes.
Yeah.
Okay, so I'm sure before you got to be a midwife, there are some processes that you went through. You went through school. What midwifery is a speciality, right?
Yeah.
Okay, cool. Okay, I just want us to quickly get into how does a person get into this profession of being a registered nurse? What do you study? Where do you study it? Also how long it takes. Just give us a description of the course itself.
So I did my degree, which was then called a BTech nursing degree at the Tshwane University of Technology, where it was a 4-year degree. Well, they call it a BTech, so it was a 4-year degree. However, there are like a variety of universities that offer the program, like your UP, UJ, Wits.
Yeah. You can
Name them.
I'll also just add the universities that offers the course. I'll add it on the description box. You can also check there.
Yes. And like I said, it was a 4-year degree where like you have to incorporate your practicals and your school, basically. So you like have to like integrate both of them, your school and your practicals. So yeah. Yes.
I always thought like with the University of Technology, it's always like a B-Tech, you know. I don't know.
You're right. You're right, but lately, allegedly though.
Allegedly,
yes.
But we'll confirm this.
Yes.
If there's anything else, we'll just add on the description box. But yeah.
Yes. So they're trying to change the Tshwane University of Technology from being a technical university to a university. Hence, they're changing like your nursing into like your Bachelor of Nursing Science rather than BTech in Nursing Science.
I think it makes better sense. Tech and nursing.
Yeah,
so I think it makes better sense. And then how long does it take with the course itself?
It's a 4-year degree. Both for BTech and
you did mention it,
I
right?
did. I did.
4-year degree.
Yeah, it's a 4-year degree.
Okay, and then how does one apply? Let's say I'm a grade 12 student.
Yes.
I'm looking into applying to become a nurse. How do I not to become a nurse, but to be a student for Bachelor of Nursing.
A student nurse.
Yes, a student nurse.
Yeah.
How do I go about it? Where do you find the information as well?
So let's establish the fact that you need to have proper and right requirements.
Okay.
For the degree.
What are those?
Right? So for universities, most of the universities, you need to have an APS score of 28. But with Tshwane University of Technology, it's like 25. However, if you have your APS score of 25, you stand a chance of writing an assessment test. But if you have your APS score of 28 to 30, it's an automatic exception.
Like without going through the process of writing a test. This is an MBT test.
Something like that, yes.
Or it's like a test which is specifically for the university.
For TET. Yes, for TET. And with other universities like your VET, you have to have your NBT test and your UPs and other universities.
Okay.
However, you still have to, you're still required to have your 3 level 4s. Level 4 is like 15, you're 50%. Yeah. You need to have that. For maths,
subjects.
In maths, in English, and in life sciences. That's University of Technology, UJ, and UP. Now with VET, it's a different story.
What's the difference?
It's a different ball game with
okay.
VET. So with VET, you still have to have your 350s. However, you need to have an additional of 2 subjects that will sum up into a percentage of 60%. And then you're going to write your NBT test. And your NBT test has to sum up into 40. And when they combine them, they're going to make 100%. So that's the difference between all the other universities and VETs. Yes.
Okay, and then let's say you apply now. I don't know, when you go into the universities, are the bursary readily available? Is the information out there? Or is it NSFAS or the specific? I don't know, like what?
So with nursing,
what was your experience?
I used NSFAS.
Okay, me too.
I used NSFAS. We NSFAS baby.
We NSFAS babies.
I used NSFAS. But I know there's a bursary that is called ISFAB. What's the other name now? Yeah, it's called ISFAB now.
Is it for nursing?
No. It's for
health science.
Let's say it's for health science students. But I'd advise one to go for NSFAS because you're not gonna worry about anything.
Yeah. So like you always find I've noticed when I do the school visits in the rural areas, you find situations where people are saying that they can't go to school because they don't have money to pay for school. Guys, you don't have to have money to pay for school. Like NSFAS, NSFAS, however you call it, it's right out there, and other bursaries as well. So I think it's also good to just, even when you're in grade 12 right now, to just check on Google, on the portals, what bursaries are available. If you don't get those bursaries, you also have a resort to go to NSFAS that when you get to the university, you can even do it a year before. But if you are too late for that, they also sometimes accept. Okay, I don't know about now, because I'm talking about something like 2014. 2014, but just apply on time. Actually, apply on time, and I don't think you should. It should be a concern that I don't have money to go and study. All right. Okay, so now you are in the university. How is the actual course itself? Like, just give me a brief summary of how the 4 years are, and like, what are your majors? You don't even have to explain everything. Just how's the...
I don't think we have majors per se, but I know we have disciplines that every year we have to, we are being introduced to. For instance, nursing is divided into 3. So there's like your psychiatry nursing, there's your midwifery, which is childbirth, and there's community nursing, like your sisters, they by the clinics and stuff. So for every year, there's like an introduction of each of those things.
So that's when you can see that, I'd love to be in this field. I'd love to be in this field.
Yes.
And that's why you're a midwife.
Yeah. That's why I'm a midwife.
Yeah, but anyways.
So yes. And also, I forgot to say, did I even say this? That we actually go to practicals from first year and J. They don't wait for you to adjust or whatsoever.
Because I know, with being a doctor with NPCHB, I think only fourth, somewhere there, but not first. Like, you guys are in the hospital from the first year. So you can decide most. If I don't like this, I'm done. In first year.
You can just go you know what? But we go to practicals from first year. You're being exposed to, for the first 2 years, it's general nursing. You're being taught on basic nursing, basic care, you know, and then from the mid-second year, third and fourth, then you're then introduced to your midwifery, your psychiatry nursing, and your community nursing. Yes.
All right. No, it's quite interesting. And then when you finish, what happens thereafter? Like, what happens? Do you go look for a job? And how's the market?
Hectic.
Okay.
So, as soon as you're done with your 4-year degree, the Department of Education, I should think, it places you. Well, you have to apply first.
Yeah.
But then it then places you to rural hospitals, I should put it.
Only rural?
Not entirely, but I know with like Tshwane University of Technology students that are being placed in rural areas. But
is there any specific reason?
I know.
Okay, but I also have a friend who was paid in a rural, but she's also from UP. But anyways, yeah. And I guess you're just lucky to have the CT hospitals.
Yeah, I think so too. Okay. Then you are being placed in a rural, or in a hospital rather, for argument's sake, let's just say in a hospital for community service.
You don't choose.
You don't get to choose for yourself, right?
It doesn't matter whether you have family there, nothing.
No, my darling. No, you don't choose for yourself. And it's for the duration of 12 months where you are being exposed. Now you have the responsibility of being a professional nurse now.
Yeah.
You're no longer like going behind someone. Now you're a sister.
Are you reporting to someone? Is there someone, I don't know, like, I mean, they still need to drag your feet, I guess. Oh, but you've been in hospital for 4 years. You've already started seeing how it goes.
As a student, but now remember, you're a sister. You're a professional.
Yes. So who's training you?
Not that you're being trained. Remember, you've got the whole experience and background on what's happening in a hospital.
Yeah.
But then you obviously gonna have like a manager that you have to report to, but now you have to take accountability and responsibility as a professional nurse.
Yeah, but the first time you had to go find that vein and
I did those things while I was in school.
Oh, so you're practically in training your entire school.
Yes.
Okay.
Then when you get there, now you're a sister. No one goes behind you to say, put up this drip properly. Hey, take out the head of the baby. No, now you know what you're doing.
You love heads of the baby. But we'll get to midwifery. But anyways, I just want us to talk about, so this is what we call ComServ.
Yes, that's ComServ.
Community service.
Thank you.
All right, okay. And then how was your experience personally, not to generalize it?
I would say that it was a quite an interesting experience because from being a girl from Pretoria, from the hood, going to the rurals.
How rural?
Very rural. Very rural. There's no KFC, nothing whatsoever. But I had to adjust. Very rural.
No, but KFC is there.
No, it's not there. There's nothing. It's not there. There's nothing. Also, getting to a new environment or a new place.
You don't know anyone?
Yeah, literally you know one there.
Sure. But the accommodation, do you get it?
Fortunately enough, they provided me with accommodation.
The hospital?
Yeah. Okay. It was a nurse's home, kind of a...
All right.
Yes. The people, they babua Setswana. They speak Setswana. No, I'm Praetorian. I had to adjust.
Bikinyana somewhere there. It's not like you went to Zululand, then it was also a kuruma.
But yeah, but it was interesting. But yeah, I think it was one of the challenges that I encountered there was the fact that I went there as a baby. I was very tiny. I was very young, and everyone
How old were you at that time?
21, 22.
Okay.
Yeah, something like. And everyone could tell that this one is a baby, and they took advantage of that.
I don't like that.
I don't like that either.
I don't like that. I mean, even where I work with older people.
Yeah.
But we just show each other that mutual respect. Yeah. Some people as old enough to be my grandparents, but hey, when it comes to the working space, it's not
nice.
Yeah, it's not nice.
And I had to grow a thick skin, and I had to wear my epaulets and
no time for smiling and being kind. Okay, be kind, but reasonably so.
Yeah.
Okay, and then after a year, what happened?
After a year, I had to come back home.
So after a year, you look for a job, and this time around, the government doesn't assist you.
So initially, they had told us that they were going to absorb us
at that hospital. Oh, okay.
To my surprise, they were like, "Girl, pack your bags
and leave.
Be done." It was the saddest. Like, I was so sad.
And you were already used to the environment.
Yeah, that's the thing. And yeah, after my 12th month, I had to leave and come back home.
Yeah.
Unemployed.
So you didn't apply for jobs? Or they told you they were gonna... But I guess you still apply though.
But then I did not apply for any job or anything. I was just like, let me just go back home and see to finish.
Okay.
Right?
Mm-hmm.
Yeah. Came back home and I mean, Steve has always been there for me from
Who?
me being at Steve Biko.
Sorry,
Steve Biko.
I'm like, who's Steve? Do you have a man? Is that a man's name, Steve?
Steve has always been there for me.
Imagine someone saying that Steve has always been there for me. How much I know Steve Biko?
Steve Biko, guys, academic hospital. And I was just like, you know what? I have a home. Let me actually go back to Steve Biko and try to do overtime. Okay, they call them locums. Matoho. Yes, yeah. Yeah, and then I applied for agencies and I went to Steve Biko. And when I got
So I didn't know like agencies take you to government hospitals.
and private.
Yeah, and I do know a government.
Yeah, it does. But it's not all agencies though.
Okay,
Yeah.
cool. So you applied for agencies and then you went to Steve Biko.
Or actually for like even for private.
For private as well.
Like I was desperate for work and you know, I was like, I'm going
Anyway.
yeah. But I started at Steve Biko.
How long did this take you?
2022 April? No, not April. I don't remember much. April, May.
So you started working after 5 months?
No, you mean
Wait, to get your job after coming back unemployed?
I did not get a job for the whole 2 years. Oh, a year. Sorry.
So you didn't get a permanent job.
Permanent job. I was working locums.
Okay.
Which is the most devastating thing on earth.
Okay. But your salaries are good then, Musio. You get
but
all
now
your benefits and everything.
When you're doing locums or when you're working private, I mean when you're working as a permanent.
No, as a permanent you pay so many things towards
No,
benefits.
as a locum, remember you're not like stationed to one hospital. And they only call you when they need you.
Oh yeah, that's the distance. Ooh,
yes. They only call you when they need you. And now you're desperate because now you have bills to pay. Well, it was the most devastating thing because if they decide that they don't want you,
sure.
I mean, if the patient is being discharged, they're gonna be like, especially in private, they're gonna be like, oh, Sister Katso, the patient is being discharged. You don't have any patients. Then you have to go back home with no money. So it's not nice.
Okay, then how did you land yourself the job you're currently in?
So I was still working. Then I started working agency school, then because I was consistent and like I was just a permanent tourist. You know, I was a permanent tourist there, and then they I think they had contract. They had a 4-month contract, and they were like, "You are our permanent tourist, therefore we're gonna give you this contract."
Ooh, guys, you see that begezeling when you think God won't come through, just hang in there, guys.
Then I think the contract was for 4 months, and then they didn't have a post for me. They're like, "Girl,
bye.
We're gonna give you another contract for 12 years because we don't have a posters yet." And I'm just like, okay now.
That's better than girl bye.
And then for after 12 months, they're just like, "Girl, no, we gotta take you. You're a person."
You see God. Tell me, then how do you get into midwifery? Like,
but remember, I'm already a midwife.
How? But when I thought midwifery. Okay, guys, I also don't know much about this, right? I'm thinking that you go to a specific college or something where you go write exams to become a midwife.
No, but like I said in the beginning, that it's divided into 3.
Yeah, but when you graduate as a bachelor, as a nurse.
With 3 of them. These things, they have meaning.
What is it? Tell us. Okay.
So the green one is the midwifery. The yellow one is the psychiatry, Vescopisi.
So go
Vescopisi choice.
And
then this one is for community or clinic nurses. So already I'm a midwife.
Does everyone who graduates at TUT get this?
Then, not now. Remember they've changed the curriculum. Then, anyone graduates at TUT, UP, VERT, then.
Okay.
Yes.
Tell me if I'm wrong.
Yes.
You can also graduate from university and specialize after when you're working in midwifery.
Like now, I'm specializing.
In what?
In advanced midwifery. Remember, this is big, guys. This is just basic.
But when you graduate, don't you graduate? Okay, guys, I might be repetitive. I want to understand, and I'm sure you want to understand as well.
Yeah.
When you graduate, you graduated from TUT as a midwife,
as a professional nurse. Yes.
So,
with all these things. You can call me a psychiatric nurse because I am.
Okay.
But I choose not to
Midwife
want to be identified by this.
I think I understand.
Yeah.
And then you're saying now you are studying. So you're not a general. You can't be a general nurse.
No, I'm not a general nurse. The general nurses don't have these things. It's just plain.
That's why, guys. You know the nurses who have these things.
Yes.
They make sure you must see them, and they will always have them.
Yeah, Bella.
Yeah, because I mean, we do find general nurses in the wards who don't have these.
Yes.
But then what did they study then?
They studied nursing, general. And nothing of the introduction of the midwifery of the site. Just general. Yes.
Okay. So now you're saying you're doing advanced.
Yes.
How? Please tell us about that.
So, advanced. So there's advanced whatever. There's a specialty for all these things. There's advanced psychiatry. There's advanced community, which is PHC. There's advanced midwifery, which is like your advanced midwives. The boss what are called maternity.
Okay.
There's that. And that is offered in UJ, Karunka College, and Western Cape, I think. Yes.
Okay. All right. And then, I mean, if there's more, you guys can also tell us in the comment box that you know, especially if you're a nurse and you know. And then now that I'm sure that how it works, you're a midwife.
Yes.
How is the profession? How is midwifery? Just explain midwifery a little bit, just in one sentence. Like, don't be too long. I think we've been chatting for quite a while, but yeah, please explain what midwifery is and how it is for you.
Basically, midwifery is the care of a mother and their unborn child, or a mother and their baby. Basically.
Yeah, when I hear midwife, I just hear people who are standing here when I'm giving birth. That's all I know.
But that's not all that we do.
They help me give birth.
Well, in the layman's term, you can say that they help you deliver your baby.
Yeah.
You can say that basically.
So you're always there in the labor ward.
Mama Pusha.
I hope you're not mean.
No.
Because you guys are mean.
No.
Well, I haven't given birth, but that's what people say.
No. You're the nicest people on earth.
All right.
No, I'm not mean. I'm very lovely.
Okay. No, that's great. No, I was recently watching a video of I think Rekhudise, you know them?
Yeah, Rekhud.
Yeah, they were talking about their journey and how they're just thanking their midwife.
Yeah.
Because for me, it's just like, wow, like they are really, really so thankful because they took them through the journey, like even in the hospital, walking around with them, you know, massaging them. Look, I think it's a very important profession, which comes with a lot of care, and it needs a lot of care and passion because you are dealing with people, you are dealing with something which is very... 2 lives. It's very interesting. Do you have anything else to add on regarding your profession or any advice that you have for people who will be watching before we close this video?
Okay, so I think we forgot to talk about one thing.
Okay.
How can you like grow in the profession?
Oh yes. You can tell us that.
I think people only know midwives as being or are stationed in a hospital setting. You can have your own practice. You can actually open your own practice and render service there. Your antenatal visits,
You see, like, sorry to jump in. I watch a lot of YouTube videos because I don't understand why I'm always watching birth videos. I'm not saying I'm ready for a baby, but lately, even yesterday, I was watching a birth video and I just heard someone. I think Bully was talking about. I don't think she gave birth there, but she was talking about Oxford. You know, Oxford, it's like a maternity hospital, and with these midwifery clinics or midwifery, the care is the best,
top notch.
Like, that's what I wanted to add. And you get so much attention, and sometimes you need that when you're about to give birth than in a hospital setting. Yes, the service is good, but they specialize in that and they focus on you. So you were talking about how you can grow. You can actually open that. Yes, you can actually have your own practice, and how you can also grow in terms of your academics. You can go into the academic route and become a lecturer for midwifery or whatever, a PhD doctor or masters and whatever. You can
actually grow in the profession.
Yes.
You're not only like stationed to like being in a hospital setting, being a midwife.
You can even be a unit manager, even on
that's hospital setting.
Oh, yeah.
You can be a prof.
Yeah.
Prof. You know. So yeah.
Okay, no, that's quite interesting. One last question.
Yes.
I said I was done. Is the money satisfactory?
Well,
but you guys can be tochis, so at least you can get to even do extra.
I'm not gonna lie to people and say, I think money is never enough.
Yeah, money depends on your lifestyle.
Okay, case closed. Church is out.
Yeah.
Because based on my lifestyle, my money is not enough, guys.
But you're managing quite well with it, so surviving. And like, as a permanent employer, you can still do the
Tochis.
Yeah, guys, tochis is like going to work overtime somewhere.
Yeah. Or even in your hospital.
Or even in your hospital, yes. Yeah. Even in your hospital, you can still do that.
Yes.
At least you do get such opportunities where you can even make more money than your basic.
True.
So.
But it's addictive.
Yeah, but I don't know, if you don't have a family, why not? It's like.
But you have
I would do it.
You have school.
I don't. What I do doesn't allow me to do overtime.
Really?
If I had the opportunity, I would do it, guys, because I just want
moolah
and travel and do everything. But yeah, so I guess it shouldn't get to the point where you just get addicted to it.
True.
I think you need to rest, otherwise you'll just burn out.
Yeah, true.
That's not what we need.
Mm-hmm.
Okay, thank you so much.
Thank you for
coming to my channel. Okay, I'm just doing this because she's doing it as well. Thank you, Katso.
Thank you for having me, Cici.
I think everyone who's watching learned something today. If you do have questions that you want to ask Katso, please put them in the comment box. I will get her to come respond. She will see her name somewhere responding on the comments, because I'm not a professional in nursing, but she is. But yeah, I hope this helps, and thank you so much for watching another segment of Tackling Careers with Arehone. I promise to come back soon with another video. Please like, comment, and share this video, and I'll see you guys on the next one. Bye bye. Subscribe.